All right, we are on live. Let's do this. Yeah. What was the first topic?
Uh, it was just general cancer types and just screening, start age, key risk factors, and prevention notes. We talked about breast, cervical, colon, prostate, and lung.
So we are gonna talk about breast cancer screening, cervical cancer screening, and colon cancer screening, and did you say prostate cancer
Yeah, and lung cancer too.
and lung cancer? All right. Yeah. Let's start. Can you tell me?
All right, so for breast cancer,
Mm,
the screening modality and interval, it's a mammogram every 1 to 2 years.
mm,
Usually, the start age for this cancer is 40 to 50, so we check every, again, 1 to 2 years.
okay.
The key risk factors, that being age, family history, BRCA mutations,
Mm,
those are some of the general risk factors. And so, one of the main prevention notes is that early detection is very vital.
okay. All right. And we did you say we started at 45?
40 to 50.
40 to 50. Okay.
Yeah.
So my understanding is there are many different like guidelines. So that's why they say 40 to 50. Like a
Yeah.
U.S. like a preventive like a task force and other like a national like the national like a cancer association. They all give different 40 to 50. And after 50, anybody old 50 years old or older, we definitely just go for like every year. But
Mm.
on between 40 and 50, we make some like a mutual agreement together. We have to open the conversation and review their family history and then decide. Okay, very good, very good.
Mhm.
And next one.
So for cervical,
Mhm.
you do a pap smear and an HPV every 3 to 5 years.
Oh,
And so for the start age for these, so for 21 to 30, that's when you typically do the pap smears. And then when you're 30 and above is when you do the HPV.
okay.
And for the key risk factors, smoking and immunosuppression was what was listed online.
Mm.
And some of the preventions are regular screening, as well as a HPV vaccine.
Yeah, yeah, right. And that like from 30, I mean from 30 or older, we start the HPV together.
Mhm.
Uh, so like, can we just do without HPV in after 30? Is that an option?
I mean, I don't think it would be the best thing to do because
Yeah, yeah,
you
it
want to
is.
make sure you want to prevent this cancer. You want to take everything possible to make sure it's not actually present. So I
Yeah,
would say like it's best to have it with the pap smear as well. Rather, it's
yeah,
better safe than sorry.
yeah. I don't really see like why we would do that, but in case somebody does that, that affect the like a pap smear interval. Uh,
Mm.
so how often do we do pap smear?
I believe every 3 to 5 years.
Every 3 to 5 years. How do you tell whether to do it every 3 years or 5 years? Is there any clear cut guideline?
I'm not sure. I didn't research that
Uh,
sadly.
it's related to the HPV. Mm.
Mm.
If we do HPV and it's negative with the cell analysis also negative, then we
Mm.
do every 5 years.
Okay.
But for some reason, if we are doing it like only we are doing it only like at the cell like exam without HPV, then
Hmm.
we even after 30, we do it every 3 years. The thing is, we don't do HPV for someone who is younger than 30. So
Mm.
20 and 30, we always do every 3 years.
Hmm.
Mm.
Hmm.
And do you know if we do the pap smear in our office?
I don't know actually.
Yeah, we do.
We
Yeah,
do? Okay.
I do pap smears, but I am a male provider, right? So
Yeah.
not everybody's comfortable with doing that with me.
True.
Absolutely understandable. But we have Ranjana, we have Ashley now.
Mhm.
Both of them are like a female providers, and especially Ashley, she's been doing that for many years routinely. So
Mm.
I was so glad when they joined, and now whenever I see somebody past you for cervical cancer screening, then I tell them,
Mhm.
do it here. Yeah. Even the somebody who comes to our office for like obesity medicine, and when I
Mm.
see they're past you, and I ask them, hey, when are you gonna get the cervical like a pap smear? And they tell me, oh, I have an appointment with OBGYN maybe like 6 months later, while they're already past you, and I just tell them, you can do it here. I mean, we
Mm.
don't want to delay any like a cancer screening. So
Mm.
in case you see somebody in the future, when you are rooming the patient, when you're seeing the patient and you see somebody like the health maintenance will alert you with red color, pap smear, you can always ask. Feel free to ask. And if somebody's interested in doing it with our office, then yeah, we can schedule the appointment with them. Something to keep in mind. Alrighty, so that's cervical cancer. And cervical cancer is like, I mean, the pap smear is you detect the cancer at as soon as possible, right? So detect early stage, very early stage, even the way before it becomes a cancer. What about like preventing the cancer, like HPV vaccine? Do we have any schedule? Like when do we start it, and like how often, how many shots?
For the HPV vaccine, I didn't come across the schedule itself, but if I remember correctly, so it's 2 doses. You get it pretty early on. You get it pretty early on in life, like I think like around age 10.
Okay, close.
Yes, it's very early.
Yeah. So what I want you to look up the regular schedule. When do we start it and how many shots? But what's more important for us as a adult primary care, we see many people who never had the vaccine. So like, until when can we give the vaccine? At certain age, we don't really consider giving the vaccine. We have the catch up, like HPV, P impeder HPV, like a vaccine as well. So please look that up. Imagine you met somebody and the chart says a patient is past due for HPV vaccine, and somebody's like 25 years old. Okay, so what should we do now? We already missed like the regular like a schedule. Okay, can we catch up at this point? You can look that up and please let me know. And when you do that, please add it to our like a to-do list, so our other like a pre-med students also can see that.
Okay, so from what I've seen for the HPV vaccine schedule, that typically it's from age 9 to 12, and if you do it before the age of 15, it's on a 2-dose schedule, and the minimum interval between the doses is 5 months.
Okay.
And if it's less than 5 months, then a third dose would be required. But then for the 3-dose schedule is if you get this vaccine initially after the age of 15 or older, or if you're an immunocompromised person. So these 3 doses are then administered, I think, one at 0 months, then 1.5, 1 to 2, and then 6 months. So there's 2 different schedules depending on when you actually start giving the vaccine. So before 15 and after 15. But typically we start like 9 to 12 for HPV.
And what if you meet somebody like let's say 25 years old and they've never had HPV vaccine?
So if you meet somebody that is 25 years old and they never had it, then you would have to do a catch-up. So the 3-dose schedule, because they're above the age of 15, now taking a HPV, and then they'd have to follow the schedule: 0 months, 1 to 2 months, and then 6 months for the 3 doses.
Okay. All right. Okay. So like, let's say we met somebody like a 25 years old. I mean, age anybody's 26 years old or 26 or younger. Yeah, we have to do the catch-up vaccine. Anybody between 27 to 45, we have to talk about that. Yeah. Okay, good. And what's the other cancer?
Colon cancer. For colon cancer, we have a colonoscopy every decade, so every 10 years. Typically, the start age is, from what I've seen, 45. And key risk factors, age, given how the age that we start, 45 is, middle age, family history of it, IBD, as well as what kind of diet is the person having that could lead to a colon cancer. And so for prevention notes, I had listed here a poly-P removal. I abbreviated, I'm not entirely sure what that means. And then also having a healthy lifestyle, so having a proper diet and making sure you're active as well can prevent colon cancer from occurring.
Okay. So let's say someone has a family history of colon cancer. Their father had a colon cancer at, let's say, like at 52, then when do we start the colonoscopy for this patient?
And have they ever had it before? No colonoscopy at all?
Patient never had a colonoscopy, and they're in their 30s, and then they tell us, hey, my father had a colon cancer diagnosed in like when he was 52. I don't want to have a colon cancer, so when should I start a colonoscopy? And what would you say?
I mean, I would think it would be best to start like right away, and then from there every decade going forward, just to put the patient at ease. But that's my thing. It could be completely wrong.
Okay, I mean, you can always look that up. So we typically, when someone had like a family member had colon cancer, then we subtract 10 years from that. So I just told you, patient father had it at like a 52, right?
So then they would take it at 42.
Yeah. I mean, so we normally started at like 45, but in this case 42. But one other thing is, and like the other thing is, I said 42, but that's older than 40, right? So when someone has a family history of colon cancer, then we may even consider starting the like a colonoscopy at 40. So we have to talk about that. So 40 or 42 at least. But if someone has a family history of colon cancer at like like let's say 47 years old, then they have to start the colonoscopy at 37. So that's how we decide.
Okay, so the earliest is like around 37 in this patient's case.
Let's say their father had a colon cancer diagnosed in like 47, then that person should start the colonoscopy at 37. Right, and this is gonna affect their the interval, colonoscopy interval as well. We don't do it every 10 years anymore. It could be every 5 years. Even if the colonoscopy is completely normal, we may repeat it every 5 years.
Okay.
Yeah, that's something to keep in mind. What's the next cancer?
Prostate cancer. And so the screening modality for this is a PSA and/or DRE, and this is a shared decision with the patient. And the start age is 50, but if they're considered high risk, given key risk factors such as age, African ancestry, or family history, then it would be best to start at 45. But again, interval varies. And so prevention would just be individualized screening.
Okay. So let's say you did a PSA and you are seeing a patient before me and or reviewing the lab, and you found that, oh, this guy's PSA is elevated. Like say, oh, PSA is like a 6. What are you going to do? What are you going to tell patient? You're not going to open it to patient and come back to me and quietly, or what are you going to tell patient about that?
Well, I would tell the patient, I would assume the patient isn't too knowledgeable about PSA, but I would like tell them, explain about it, what the number means, and what we might have to do, and then I would review it with you.
Okay. So what I normally do is PSA is very sensitive. PSA is a good like prostate cancer screening tool because it's very sensitive. But that's the problem of PSA. It's too sensitive. It goes up from many things. It doesn't have to be. Sometimes after riding riding bike for a long time, a PSA may go up. After like ejaculation, PSA may go up, and it could be like a prostate inflammation or infection there too. So there are many other things that can cause the PSA elevation. So whenever I see a high PSA, instead of jumping into like a urology referral or like a biopsy, instead make sure he didn't do anything before the test to cause the elevation in the PSA, and then I repeat the test maybe like 4 weeks later, and oftentimes the repeat test is normal. So repeating the test is very important.
Okay, so double check with the patient just to see if it was like a potentially false positive then.
Yeah, false positive, and even if they say I haven't done anything to like raise the PSA, I still check it again. Yeah, and one other option is when we repeat the PSA, we just refer the patient to the urology in advance. So they have an appointment, but they don't see the patient right away. They always say, oh, we will see you like 2 months later. So we have an appointment scheduled, and between we repeat the PSA, and if the repeat PSA comes back negative, like a normal, then we can always cancel the urology. appointment. But if that repeat PSA is still elevated, we didn't delay anything because we already scheduled the appointment when we got the first test result. So that's an option. Are we done? Did we cover all the cancer?
Just the last one would be lung cancer. And so for the screening modality for lung cancer, an annual LDCT, chest radiography, and septum cytology, not recommended in the case of lung cancer. So for the start age is around 50 to 80, and this is indicated to us at least based on their significant smoking history. So like how many packs are they smoking, the duration, past 20 years, for 20 years or more, the age, are they around the age of 50, that start age? Has there also been environmental exposures? Do they work in an environment, or do they live in an environment exposed to like radion, asbestos, secondhand smoking, family members, friends that smoke, as well as do they also have chronic lung disease like COPD or pulmonary fibrosis? And prevention would be, if they're smoking, immediate cessation, as well as avoiding carcinogens within the environment.
So how much how much smoking will indicate someone older than 50 years old for like a routine lung CT?
For duration, or like a pack wise?
Like you have to find them both. So let's say someone say, I've been smoking only one cigarette a day for like 40 years. Do we have to start the regular LDCT for this guy? If someone says, I packed like 10 pack a day for 5 years, do we have to do the LDCT for this guy?
I would say yes.
So it goes by 20 pack year old. So which means we just combine 1 pack a day for 20 years. And this will be 2 packs a day for 10 years. If someone smoked half a pack a day for 40 years, then it counts. That's how we count it.
Okay.
Yeah. So when someone says, often you will hear most common scenario in our clinic is going to be someone like in their 60s. And they say, yeah, I mean, when in my like a younger time, everybody used to smoke at the time. And I smoked for like 30 years. Wow, that's a lot. And we have to ask the details, like how much did you smoke? And many of them say, I just smoked, only when I drink, or really like rarely, like maybe 2 cigarettes a day. Then it doesn't count. We don't have to do like a LDCT for them. Yeah. So. And also, many of them will, in the past, really so many people smoked in the past. Our awareness about smoking and their relation with many other cancers, lung cancers, wasn't as great as what it is nowadays. But many of them stopped smoking decades ago. So if someone says like, I stopped smoking 20 years ago, do we still have to do an LDCT for this guy?
If they stopped smoking 20 years ago?
Yeah.
But they smoked for, how long again?
They smoked like more than 20 pack a year. Like they smoked
20 pack a year. So I would say it would be best to check, no?
So if it's been more than 15 years since last smoking, then it stops. So for example, someone says, yeah, I smoked like 1 pack a day for 20 or 30 years, and I smoked like 7 years ago for the last time, then we start the LDCT.
Okay.
But if they say it's been 20 years since I smoked last time, then we don't do it. But here's the question. If someone smoked 7 years ago last time, so it's been 7 years smoke-free, how long do we have to continue yearly LDCT? Until when? When do we stop LDCT?
I guess until we've reached that like more than 15-year threshold.
Yes, exactly. Yeah. So maybe 8 more years, right? And then after 8 years, we will say, oh, last smoking was more than 15 years ago, so we can stop the LDCT. But of course, if we find something, that's a different story. If there's a nodule or something, then of course we have to keep monitoring it. But saying that the LTCT was normal and it's been 8 years, and we've been monitoring it for 8 years, and it's been 15 years smoking free, then we can safely stop the screening. So we talked about, the multiple cancer screenings, and this is what as you saw, this is what I start annual, like a wellness visit or a comprehensive physical exam or like a regular routine checkup. I always start with the cancer screening. So now when you open our patient's chart, you're going to see that in the left lower side, like a health maintenance, and it's going to show you what screening, what like a cancer screening is overdue. So you can better discuss with the patient. Alrighty. Any question?
No. I mean, these are like the main 5 cancer types to check for, right?
Yeah. And don't ask me any questions. This is live, so I may not know the answer. So thank you. And we will talk about some other later. I will end the live.
All right.